taking and recording a full set of vital signs, which includes temperature, pulse, respirations, and blood pressure. Knock, knock. Hello, Mrs. Smith.
Hello.
My name is Lisa, and I'm going to be your CNA today, and I came to take a set of vital signs, okay? I'm going to go wash my hands before we get started and provide privacy, and I'll be right with you. So I'm going to wash my hands, I'm going to provide privacy, and for my supplies, I've got a thermometer, I've got a blood pressure cuff, and a stethoscope, and I have a watch with a second hand. Okay, I think that's it. So I'm going to go ahead and position Mrs. Smith here. She's laying in the bed. She's semi-Fowler's position. That's fine. Are you comfortable?
Yes.
Okay, so let me start with, go ahead, I'm going to take your temperature first, okay? So with the digital thermometer, I'm going to remove the probe until wait for it to beep. I'm going to place the probe cover on. I'm push down kind of hard to get it to snap on. Okay, and then this is going to go under your tongue, okay, until the thermometer beeps. Very good. 97.9. I'm going to, degrees Fahrenheit. I'm going to go ahead and get rid of my probe in the trash can right over here. Just push the button and it pops off. Okay, I'm going to place that back in the holder. And I'm going to document her temperature. 97.9. And I also want to document the site. That was an oral temperature, so I'm going to write oral next to that. Okay. Now, I'm going to do your pulse and respirations. Okay, Mrs. Smith? Okay. All right, so I'm going to go ahead and find her radial pulse. It's on the anterior side of the thumb side of the anterior wrist. And I'm going to feel it with 2 to 3 fingers. You never want to feel a pulse with your thumb, so I'm going to use my fingertips here. And I'm also going to go ahead and turn your palm prone. You can do it with the palm up or down, just whatever you prefer, whatever is most comfortable. Is this okay for you? That's great. Okay, thank you. All right, I'm going to count her radial pulse for 1 full minute. I'm going to use this clock over here, so when I'm going to start when it gets to the 12, and then when it comes back around to the 12 after 1 full minute, I'm going to count her respirations. So 1 inhale, 1 full inhale and exhale is 1. So I'm going to count pulse for 1 minute, respirations for 1 minute. Okay, and you just relax. Thank you, Mrs. Smith. Thank you, Mrs. Smith. I counted her pulse rate at 63 beats per minute, and your respiratory rate is 15. Now when I record those, I don't have to write 63 beats per minute. I just write 63, and it's understood that that's for 1 full minute. And what I'm feeling for with the radial pulse is every time I feel the pulse hit my fingertips, that's 1 beat, okay? So between 60 and 100 is normal average for an adult. So that's good. Respiratory rate, I counted 15. A full inhale and a full exhale is 1. And I counted 15. Anywhere between 12 and 20 would be normal for an adult. So if it was anything less than 12 or greater than 20, I would go ahead and report that to the nurse. Okay, the last thing we're going to do is take your blood pressure. Okay? All right, so to do blood pressure, the first thing I want to do is have my equipment ready. And I'm going to go ahead and clean my stethoscope. Ooh, and it's broken. That's going to have to be put together. Okay, so I'm going to clean the earpieces with some alcohol, and I'm also going to clean the diaphragm of the stethoscope. The diaphragm is the larger side, and the bell side is this other side here. Okay. Toss that in the trash can. Alright, so this is ready. Got my blood pressure cuff here. I'm going to go ahead and find your brachial pulse. Okay, the brachial pulse, I always start right in the center of the antecubital space. Again, don't use your thumb, use your fingertips. And I'm going to start in the center here, and then like the inside of the elbow, and then I'm going to work my way inside. And it is a deeper artery, so I am going to have to push down a little harder to feel that, to palpate it. Okay? I'm going to line up on my blood pressure cuff the artery marker here. This is Mrs. Smith's left arm, so I'm going to line up the artery marker with where I felt that brachial pulse. Okay, very good, thank you. Just straighten your arm there for me. And I'm going to place this cuff around it. I want it to be snug, and I want it to be pretty straight. Okay, very good. All right, and I want the bottom of the cuff here to be about 1 inch above the bend in the arm, of the antecubital space. Okay, ready? Okay. I'm going to make sure I can see everything here, and I'm actually going to reposition myself just a little bit. Now, when you put this stethoscope in your ears, you do want to make sure that the earpieces are angled forward or toward your patient. And I'm going to give this a little tap to make sure it is on the loudest side, because it will, you can turn it and click it and turn it off on this side where it's on the bell side. But we're going to use the diaphragm or the larger side. And that sounds good. Okay, I'm going to place this in the antecubital space. And if you'll make sure your tubing isn't going to rub or touch, that will really decrease on the extra sounds. Now I'm going to pump this up. I don't know what Mrs. Smith's blood pressure normally runs, so I'm going to go ahead and pump up the blood pressure cuff, or the sphygmomanometer, to about 180 millimeters of mercury, and then I'm going to slowly, with my valve here, I'm going to start with it turned off, just until it stops, pump it up to 180, slowly release the air, and I want my needle to drop slow and steady, about 5 to 10 millimeters of mercury per second. Okay, so it's pretty slow. You have to do it fairly slow to be accurate, but we do want a steady drop of the needle. Okay, are you ready, Mrs. Smith? This is going to squeeze your arm just a bit, but it's only going to last a few seconds, okay? Okay, 120 over 82. All right, go ahead and remove this blood pressure cuff. Thank you. I'm going to record the result as a fraction. 120 over 82. And I also want to date and time this, and I'm going to record that in Mrs. Smith's chart. All right, I'm going to go ahead and clean this stethoscope one more time after using it to make sure that it's clean for the next person in case they do forget to clean it before they use it. Is there anything else do you need anything right now, Mrs. Smith?
No.
No? Are you comfortable?
Yes, ma'am.
Okay, well thanks for letting me take your vital signs.
Thank you.
And I'm going to go ahead and store these supplies. And I'm going to wash my hands before I leave the room, and I'm going to unprovide privacy, open the curtain back up, and I'm going to go document in her record her vital signs. And if there was anything abnormal outside of the normal range, I'd report that to the nurse immediately. Okay, thank you.
Thank you.